we present updated results really at this time focused on AML patients and in particular P53 mutant AML patients. So the combination, both in the total cohort as well as in P53 mutant patients, led to a response rate in about 2/3 of patients with between 42 and 45% true complete remission rate, with nearly all patients having some level of blast reduction. And really the quality of remissions is quite robust, with about 2/3 of patients being transfusion independent, a high percentage of patients having complete cytogenetic clearance, and by a very sensitive multiparameter flow cytometry assay, about 1/3 of patients having MRD negativity. The responses occur quite rapidly. Median time to response is about 2 months. And I think importantly, these responses are durable. So particularly when we look at overall survival, and we now have 47 P53 mutant AML patients, that's as large as I would say any cohort, larger than the VIALE-A cohort as an example for P53 specifically. Although follow-up is short with the median follow-up of 5 months, the median OS is nearly 13 months. And I would say in a elderly P53 mutant AML patient population, that's as good of a survival that's been observed in P53 mutant AML patients. And given a lot of patients are still censored early on treatment, this overall survival may further improve. And despite the standard of care changing with HMA venetoclax, I think these data are exciting to the point that they really support a phase 3 trial that's going to launch of Magrolimab versus venetoclax for P53 mutant AML. I think a little bit more broadly, we did have 16 patients with wild-type disease. Their median overall survival with a more mature follow-up was nearly 19 months. And so I think this is also favorable. So I think there's a lot of interest in testing Magrolimab more broadly throughout AML, particularly for triplets in the wild-type patient population, with an IIT that is active and more concepts going forward specifically in that patient population, both likely as frontline and in relapse refractory patient populations.